A child's early years of life are incredibly important. What happens during the first 5 years has lifelong effects. That's because the brain develops rapidly during these years and changes based on a child's experiences. If children receive good quality stimulation, support, and nurturance during these years, the brain will develop in healthy ways, giving children a strong foundation for future success. Sadly, not all children have positive experiences during these crucial years and lack the stimulation, support, and nurturance needed for the brain to develop in the healthiest way possible. That means there are more challenges for these children as they grow. But if we help children and families early on, we can avoid many of these negative outcomes thanks to the brain's ability to easily change and adapt at this stage, something that becomes much harder as we age. Investing resources during this unique window of opportunity provides the best return on investment, with governments receiving between $4 and $8 back in benefits for every $1 spent on early childhood programs. That is why knowing how our young children are doing is so vital for their future well-being. If we don't know how children are doing, we can't identify any problems, we can't effectively help them, and we won't know if things are getting better or worse. To stay informed about children's early development, communities across Canada and around the world are using the Early Development Instrument, or EDI for short. The EDI is a teacher-completed questionnaire developed by Drs. Dan Offord and Magdalena Janis at McMaster University in Hamilton, Ontario, Canada. The EDI measures kindergarten children's ability to meet age-appropriate and developmental expectations across 5 general areas.
Imagine a community that thinks first about its children. The health and well-being of a community's children is a clear indicator of its current and future well-being. My name is Emily Kleinecke. I'm the Executive Director of Alignment Rockford. Alignment Rockford is a collective impact agency in the city of Rockford that does work around empowering youth and families and helping all children in Rockford reach their potential. We partner with the Rockford Public School District and other area agencies and organizations to work to address issues and gaps in the educational experiences of students and youth in Rockford. A community that invests in its children and surrounds its families with supports and resources is a community that thrives economically, socially, and civically. The most important developmental period in a human lifetime is 0 to 5. And during that time, there is no institutionalized support for families and caregivers of young children. Parents and caregivers are the first teachers of a young child, and it is critical that they have the resources and support that they need in order to be able to foster healthy development. I'm excited about this project because it gives our community the opportunity to identify the real needs of our youngest residents and work together to set goals that will make a meaningful impact on their lives.
The survey isn't measuring individual students. It's coupled with census tracking data, so it's going to tell you about the community, about the neighborhoods as a whole. It's given to the kindergartners by the teachers, and it's going to measure for you 5 different domains. That first domain being physical health and well-being. The second domain is social competence. Third is emotional maturity. The next is language and cognitive skills. And that 5th domain is communication skills and general knowledge. The EDI provides us data that allows us to be able to provide resources for our families and the educators for our children birth to 5. Now, with the support of the Winnebago County Community Mental Health Board, Alignment Rockford is working to expand the EDI and the check throughout all the schools throughout Winnebago County.
Our focus on mental health is important because in those early years, trauma and adverse experiences can negatively impact how a child shows up in school and in life. Hi, I'm Jaleesa Bondurant, and I'm the Early Childhood Mental Health and Data Project Manager at Alignment Rockford. So this is a 3-year project. This first year is our preparation year. We have hired the staff, we have completed trainings, we have partnered with UCLA, which is the repository agent for all of the data. Given that the data can be geolocated, it allows us to identify the vulnerabilities of our children by their neighborhoods. We're able to target resources and programs, as well as advocate for effective policies within our schools, as well as within our cities within Winnebago County. Other area nonprofits and organizations can really use the data to center around their programming. So if we all want to move the needle forward for our children, having an aligned data set that we're all operating off of can improve the outcomes of our children. So between that, as well as alleviating some of the pressures on the system, because we're increasing the coordination of services and streamlining them for our families and getting them to where they're needed. So for us, the surveys that we're conducting in our work here at Alignment Rockford aim to support emotional development, academic outcomes, and family and community support. Our children deserve to thrive, and we have a responsibility in our community to provide an environment where they can thrive, both in and out of school.
Thank you to the Mental Health Board for supporting this project. We are confident that this will bring meaningful impact to the county around early childhood mental health and well-being.